Louise Thompson has opened up about a deeply personal and challenging chapter in her life as she and her partner Ryan Libbey navigate the difficult path toward expanding their family. The 35-year-old television personality, known for her candid sharing on social media, has been documenting her ongoing fertility journey following severe complications from the birth of her son Leo in 2021. That traumatic experience, which involved an emergency cesarean section and left her fighting for her life, has profoundly shaped her decisions about future pregnancies. She has made it clear that due to lasting physical damage, including significant scarring and related conditions, she is unable to carry another child herself. Instead, the couple is pursuing surrogacy while addressing their emotional and psychological well-being. In a recent appearance on a podcast focused on happiness and mental wellness, Louise shared intimate details about how this process has impacted both her and Ryan. She explained that they deeply desire to give Leo a sibling, drawing from their own close relationships with brothers and sisters. The bond they share as a family motivates them, yet the road ahead feels anything but straightforward. Louise has chosen to freeze some of her remaining fertility as a precautionary measure while they continue prioritizing mental health recovery. She described this step as essential because the emotional toll of trying to grow their family has been immense, particularly on Ryan. She reflected on how the situation has affected her partner almost more severely than herself, especially regarding their hopes for additional children. For Ryan, the fear of risking further complications or loss looms large, leading him to question why they should push forward when they already feel incredibly fortunate. Louise acknowledged their blessings. She survived a life-threatening ordeal, she maintains a good quality of life, and she has an extraordinary, beautiful child in Leo. Yet, she emphasized that building a larger family represents their legacy and a fundamental right. She expressed frustration that she was not afforded a safe, dignified birth experience the first time, which would have allowed natural conception without medical intervention. Instead, they face infertility challenges compounded by her medical history, making their odds significantly different from others in similar situations. Louise has been transparent about her health struggles since Leo's arrival. She developed PTSD and postnatal anxiety in the aftermath of the near-death birth. Diagnoses followed, including Lupus, Asherman syndrome, a condition involving intrauterine adhesions, a second hemorrhage, and the need for a stoma bag at one point. These issues have required ongoing management and have influenced every aspect of her fertility plans. Despite the hardships, she remains determined to share her story openly, hoping to connect with others facing similar battles. In recent social media updates, Louise detailed the practical and emotional realities of her IVF process leading toward surrogacy. She described a particularly tough day that began with devastating news from her clinic. Out of 20 eggs retrieved, only 4 had fertilized on the first day. This outcome felt heartbreaking, especially after she had felt optimistic about her body's response during stimulation. The drop from 20 eggs to 10 mature ones, and then to just 4 fertilized, left her questioning statistics and feeling demoralized. She compared it to a previous cycle where all retrieved eggs fertilized successfully, highlighting the unpredictability and emotional roller coaster of the process. Amid this disappointment, she balanced fertility appointments with professional commitments, including discussions about a new petite clothing collection and mortgage matters. These moments of normalcy provided some joy, yet she struggled with the contrast between outward positivity and the private pain of infertility. She pondered why, at 35, with strong ovarian reserve indicators and a fit partner, they should encounter such obstacles beyond the obvious uterine issues. She admitted the difficulty in maintaining optimism when the truth feels so heavy. Louise also touched on physical symptoms tied to her recovery, such as recurring blinking issues that resurfaced during promo shoots, possibly linked to stress or her nervous system. She expressed a desire for calm amid chaos. Conversations with lawyers about surrogacy arrangements added another layer, involving discussions about potential carriers and the legal complexities. She confessed to not feeling as positive as anticipated at this stage, unsure about timelines, additional cycles, or outcomes. Even reviewing embryo footage felt overwhelming, despite her analytical nature and love for data. She described lacking the mental bandwidth to obsess over every detail, which she viewed as potentially beneficial. Work and creative pursuits helped prevent fertility from consuming her entirely. Small joys, like receiving thoughtful gifts from colleagues, sustain her. She emphasized staying active, writing, and leaning on positive moments to endure. Earlier updates captured raw vulnerability. One video showed her in tears after the embryologist call, feeling rank and demoralized by the low fertilization rate. She wiped away tears while sharing statistics, worried about embryo progression to day 5. Yet, she noted some positive shifts afterward, with additional eggs maturing and fertilizing attempts continuing. In captions, she acknowledged the hormonal or emotional nature of her reactions but highlighted improvements. Leading up to egg retrieval, Louise shared exhaustion from her first IVF cycle, obsessing over cell division details while managing family life, including an overnight hospital stay with Leo for scarlet fever. Trigger night brought relief after days of feeling heavy, sore, and feverish. She hid symptoms to avoid delaying the cycle. The process triggered memories of past hospital recoveries, intensifying emotional strain. She microdosed pain relief cautiously, fearing impacts on egg quality.